I'll make start. So hello again, everyone, and welcome. I'm Shazana. I'm the network lead for the Mentally Healthier Councils Network, and I'm really excited to be launching our brand new framework today. I'm also delighted to be joined by Lisa McNally as a Director of Public Health from Worcestershire County Council, who's co-chairing me today. And we have Joe and Sinead from Birmingham, who'll be talking about their Creating a Mentally Healthier City strategy. We'll also hear from Charlene at the Health Foundation, who are our generous funders of the network. And then we'll hand over to Andy Bell, who'll explore the implications of the government's 10-year health plan. So we hope to have some really fruitful discussions on that. I just want to start by thanking all the councils who responded to our survey, which is, 2 years ago now? And who inputted into this work, and specifically the three testing councils, so Worcestershire County Council, Leeds City and Birmingham City, for all your valuable insights. Big thank you to the Health Foundation for funding our work, and also to Ed Davey and Bethan Bottomley, who used to work at the centre and kickstarted everything that we did. So I'm just going to share my slides with you. If I can find them, just bear with me 1 second. Where are they? Right, I hope you can all see that. Please scream at me if you can't, because I'm on my notes. And Hannah's going to add the link in the chat as well to the framework. So the aim of the new framework is to embed mental health as a core priority in all council strategies, policies and operations to help build a mentally healthy environment for both residents and the workforce. The framework has been informed and shaped by our council members who told us what criteria they think is priority, and these have been organised into 5 key areas. The framework is a 10-point checklist, and each point outlines practical steps that you can take to promote well-being and reduce risk factors that harm mental health. We think these are all easy to demonstrate. They're not going to be costly to councils either, and have been proven to show that they will improve mental health. Oops, sorry. I think I've lost my note, so just bear with me 1 second. Sorry about this. Typical IT problems when that happens. Okay, so there we go. So here's a snapshot of the framework, which outlines the 5 priority areas that align with the key social determinants of mental health. So we have strengthening accountability and prioritising mental health in all policies, tackling poverty and reducing financial inequality to protect mental health, improving the environment and creating places that actively support mental health and well-being, supporting prevention and early intervention for a mentally healthier start in life, and embedding equity and inclusion and delivering fair and culturally responsive mental health support. So here's a PDF version which is on the website and can be downloaded from the web link. I won't go through each point just to save on time, but we've included things like applying a bespoke mental health policy test, publishing a recent mental health needs assessment, adopting the Living Wage Foundation accreditation, and all the links to these as well are on the website. So other things like ensuring safe and affordable housing, providing high quality and free parenting support through Best Start family hubs. And then we have added the prevention concordat on there as our final point. Now the sign-up process for the prevention concordat is paused at the moment because OHID are refreshing this, and they're looking to relaunch it later in the year, hopefully. So in the meantime, you could consider working with mental health providers to deliver the patient and carer race equality framework to embed racial justice within mental health, or aligning with the marketplace's principles where appropriate. So I'm going to stop sharing. I'm going to stop sharing there. And on the web page, which if I can just share a second, sorry about this. Here we go. Nope, that's the wrong one, isn't it? That's the wrong one. Share. Sorry, there should be easier ways of doing this. There we go. Hope you can all see that. So on the web page, we've included the case studies from Leeds and Worcestershire, so you can see how other councils have aligned some of their activities with the framework. And we'll also add on Birmingham's presentation and links to their work as well after today, once they present on that. So this is just a whistle-stop tour of the framework. Please do explore it in your own time. If you look further down where we have the drop-down, and in each section we add a little bit more about each kind of priority and activity. So please do explore it in your own time. Please do share it with colleagues and let us know your thoughts as well. I'll hand over to Lisa now.
Lovely, thank you. Really good introduction. So good afternoon, colleagues. Thanks so much for joining this session. We know how busy everyone is, and we really appreciate you giving up a bit of your time to come and have a chat with us. So mental health. I was thinking that the question of whether local authorities can have an impact on mental health is, I think, a moot point. My view is that local authorities don't have a choice as to whether they have an impact on mental health. I think that we, within our local authorities, depending on which type of council we work for, we influence education, housing, public health, the environment, and so many other factors, and of course social care, and so many other factors that will, whether we as councils like it or not, impact on our population's mental health. And I remember in a discussion with our with cabinet members once, we were talking about mental health, and I asked them, who is it in our area that affects mental health the most? Who are the big decision makers on mental health? And of course, answers came back like, you know, the people who lead the mental health trust, people who in the ICB who lead the commissioning of resources into mental health services. But actually, it's those cabinet members, the cabinet member for children's, for education, for social care, for housing, their decisions, and of course the officers that work for them, impact on mental health every day, whether we like it or not. The only choice we have as local authorities is whether we're going to exert a positive influence on mental health or a negative one, but we don't get to have no impact. Now, I know many of you on the call, probably all of you, will be advocates for mental health work and positive mental health within your organisations. That can be quite an isolating experience. You know, sometimes when the dominant discussions are about politics, they're about local government reorganisation, budgets, how much time at the moment in local authorities is focused on budgets, and trying to advocate for mental health work can feel a bit isolating. Sometimes it feels like we're shouting into a void. And that's why meetings like this, and I think this framework, are so important. And I'm going to steal a phrase that Andy's been teaching me, creating a hive mind. Sorry, Andy, I know that's your phrase, but creating a hive mind, being able to share experiences, feeling like we have links with each other across the country. We might be one of a few people in our council advocating for mental health, but knowing and having contact with a whole network of people facing very similar challenges can be both, bless you, can be both instructive and also supportive. So the framework that the Centre for Mental Health have come up with really nails the situation for me. We have used it in Worcestershire to critically analyse ourselves as a council, and it was invaluable for helping us focus on some of those high impact areas, and to critically reflect on, are we doing enough on this? And of course the answer when we asked ourselves that so many times was, no, we're not. This is an area where we feel we could do better. And that in turn then drove conversations across the council. You know, are we tackling poverty in the most effective way? Is there more we can do? Are there specific groups in our community who maybe aren't benefiting from our work as much as they deserve to? So the framework for me and its action areas really gave us that perfect baseline to see how we're doing and to then drive the conversations for progress. And I think importantly, we're not going to see this as a static process. So it's not a question of just using the framework once and rating ourselves. We rated ourselves green, amber, or red, depending on where we thought we were and where we thought where stakeholders thought we were. But we're going to keep coming back to this. Have we made progress on any of those areas? Have we deteriorated in some of those areas? Progress is not always linear, especially not in the world of local government. So I can highly recommend using this framework. It's a really great tool. None of you on this call will be coming from a standing start. There's so much work happening around the UK and all of your councils around mental health and population level mental health and the contribution of local authorities to that. So this can help build on the work you've already done. And finally, before I hand back, if you're free on the 26th of Feb, do come along to the presentation that we're doing on this at the LGA ADPH conference. We're on just before the Public Health Minister, so we better not overrun, and I've noted that as chair. But I think what we're going to do is speak to Andy, we'll speak to other people that have used the framework, we'll speak to Councillor Sarah Rouse, who is obviously a local authority elected member, but also a real advocate and expert on mental health. And I'm going to make sure as chair we leave at least half of our appointed time for discussion which will start today and which we can carry on in that bigger forum. So if you're coming and you're up for it, be ready to put your electronic hand up at that session, as well as this one, to talk about your work on mental health. And with that, I will hand back to you, Susanna.
Thanks, Lisa. That's really good. And I've included the link in the chat as well for the event, so please do sign up to that. I'm going to hand over to Joe and Sinead.
Yeah, thank you very much. So I'm Joe Merriman, the Service Lead for Mental Health and Wellbeing within Birmingham Public Health, and we've got Sinead here, Senior Officer for Mental Health and Wellbeing. It's a really exciting time for us. We launched our Creating a Mentally Healthy City strategy yesterday at a joint event at our council house with the Mental Health Provider Collaborative, who have a concurrent strategy that they launched at the same time. So we're really trying to work in Birmingham as a whole system and whole city to be able to join up care around mental health and make sure that prevention and community-based support is embedded all the way across the city. The presentation today, I'm going to be quite brief on the strategy because I'd quite like to open it up for discussion and kind of see how other councils are tackling some of the things that we're seeing and hopefully kind of fuel that discussion. But just to give a bit of an overview of our strategy, it's a 10-year strategy with a review period at the 5th year. We've decided to address it with two strands, mental health and wellbeing being one and suicide prevention being another, with our role in public health and public mental health being most strongly within those areas. We will have live action plans to be able to deliver upon those actions. It's really important that they're live. I think Lisa's already touched upon making sure that we're responding to things that are changing within the system. We're seeing such a change at the moment with colleagues at NHS and in the ICB. We need to make sure that action plans are live and responsive to changes in policy and design, but also need as well that we see. Our partnership is part of, so we have our Creating a Mentally Healthy City partnership, which is a subgroup of our Birmingham Health and Wellbeing Board. So we report into the Birmingham Health and Wellbeing Board. So mental health and wellbeing and suicide prevention is really firmly on the agenda within Birmingham. It's really hard to summarise what we've been doing in the last 18 months or 2 years into one slide, but hopefully this is everything that does that. We started, as we always do within public health, looking at reviewing local evidence and needs. So we looked at a number of risk and protective factors for mental health and suicidality. We looked at some local published reports so that we could learn more about some of the experiences of diverse communities within Birmingham. We then involved our people and our partners. So we did a number of stakeholder workshops. We did some community engagement events where we really focused on hearing from seldom heard communities, acknowledging that often these communities are ones that face greater challenges with mental health outcomes and also have to overcome barriers such as stigma. For suicide prevention, we really wanted to make sure that we heard from those with lived experience. So we did some sessions with people who had been bereaved by suicide, as well as people who had previously attempted self-harm or suicide. So we managed to, build in lived experience within that way. We had a draft strategy that we took out for consultation, and we heard from a total of 1,200 people and many, many more along the way in development of the strategy. As I said, our priorities are split into kind of two strands, one being mental health and wellbeing and one being suicide prevention. We've set within mental health and wellbeing those 4 priority areas as people, families, communities and places, acknowledging that we want to be able to empower and upskill people to help themselves, as well as help people within close circles, with families and communities, and then with places, everything that kind of the framework talks about, making sure that spaces and places are designed to be as mentally healthy for our citizens as possible, and making sure that we can play our role within local authority to encourage as many teams to contribute towards that as possible. The next slide brings it to life a bit more in terms of what that actually means. So within the people and families levels, you can see kind of encouraging healthy behaviours through promoting evidence-based frameworks such as the 5 Ways to Wellbeing, reducing stigma and improving knowledge and access to self-help through campaigns. Within families, making sure that we're leveraging on local things within our community, such as family hubs, and making sure mental health support is well embedded throughout those family hubs, as well as delivering and promoting cultural competence training for people who work with families. Birmingham is pretty unique. It's a super diverse city, and we really need to make sure that we use and utilise community leaders as much as possible. They're often safe and trusted voices within the communities. So it's important that we make sure that we train up community leaders so that they better understand mental health and feel like that they can be more safe and confident in talking to citizens around mental health. But we also know that there's so many community spaces which offer safety, support, warmth and hope for people. Things like libraries, faith settings, community centres, youth hubs are all spaces within the community that we really need to use as an asset for us. Within places, making sure that we're incorporating mental health and wellbeing in policy, so using things like health impact assessments and mental wellbeing impact assessments, and trying to encourage our colleagues within the council to do so. And then you can see the Mentally Healthy Council framework being used there to look at how we can improve mental health support at places like workplaces as well. Our priorities for suicide prevention align really closely with the National Suicide Prevention Strategy. So we've got 8 priority areas, and you'll see some of the wording is quite similar to that. I won't touch on all of them, but just to kind of highlight or shine a light on a few of them. Tailored targeted support priority groups, so looking at groups that have disproportionate rates of suicide. Men and middle-aged men, a particular focus for us, but we are tragically seeing a rise in self-harm and suicide among children and young people as well. Making sure that we provide effective bereavement support to people, so knowing that people who are bereaved by suicide can be more at risk of trying to take their own life, and making sure that we get that support to people as much as possible, and increasing training and skills, thinking about those people that often work on the front line and people who might be exposed to people who are at crisis, and making sure that they have the right training and skills to be able to know how to intervene and to support at that moment. This is where kind of I want to try and start bringing in the framework. We are often challenged on our outcomes and how we know that we're successful. So we've been challenged at this at our local health and wellbeing board and at our scrutiny board where we've presented. Aspirationally, we want to improve population wellbeing, reduce the prevalence of depression, reduce hospital admission for self-harm, and reduce death by suicide. But we know that there are many factors that influence those outcomes. So what we're trying to do as much as possible is to look at shorter and medium term outcomes that we can capture along the way. That includes using questionnaires and surveys and encouraging our voluntary and community partners who play such a key role within the space to do the same.
Right, okay.
I think there's some noise coming in from somewhere. Medium, and then that will kind of help our medium term outcomes. So hopefully starting to see in shifts in workplace well-being, educational well-being, as well as some of those risk and protective factors, and looking at improving things like population loneliness, and improving and providing more equitable access and recovery to local services such as NHS talking therapies. Part of how we know that we're going to be successful as well is where we see the framework being built in. So we've applied quite a similar lens as to what Lisa has done within her local authority. So red, amber, green, rating how we're performing on some of these metrics. So we have done that as a team, and you can kind of see a screenshot of a couple of those points there. What we also did is made sure that we were capturing things that are happening directly in the council, but things that also might be happening wider, so that we are also working collectively around our city and making sure that we aren't duplicating or overlapping efforts across the city, acknowledging that there is finite resource and we don't want to all be doing similar things. So finally, around the framework to assess strategy performance, I really just want to emphasise measuring outcomes and success is hard. There's many factors that influence mental health and wellbeing and suicide. Our outcomes are long-term and aspirational, and we really feel like the framework can help to show our progress in a wide range of areas. Also encouraging us to work with the wider council and partners as a one city response, and it can be helpful as well, I see, for reporting progress back to scrutiny committees and health and wellbeing boards to show that we are making progress. Finally, I was saying just before I came on the call, it was great being on this session last because I felt at home being at a call with very similar and like-minded people. So there's a few things that I just want to open up for discussion if we have the time to do so. It would be good to find out how people are measuring outcomes in their strategies and action plans to demonstrate impact. And then in terms of joint working and collaboration, how are people winning hearts and minds across councils with other departments to jointly deliver action plans, and thinking about how we can encourage framework to be used wider across the council? Is there anything else that we should be considering with joint working? And how have others built and sustained momentum and made mental wellbeing and suicide prevention business as usual within their local authority? So yeah, happy to take any questions at all about the strategy, and hopefully those questions pose some topics for discussion. Thanks for listening.
Thanks, Joe. That's great. Thank you. We have a question from Rebecca. Rebecca, you've raised your hand. Do you want to come in?
Lovely. Thanks so much, Joe. I'm Rebecca Stewart and I'm from Greenwich Local Authority, working the Adult Mental Health Commissioning team. That was great. Thanks so much for sharing, Joe. I can imagine all of the work that has gone into producing the key actions and also thinking about outcomes. So one is a question and two is a discussion thought. We are not quite there yet in terms of taking our various place-based strategies and being clear across the system about what the outcomes look like. I have a sense that what would be fantastic if is across the health, local authority and voluntary sector system, that we agree to a consistent form of wellness recovery action plan for each person, possibly living with a moderate to severe mental health condition. And I would very much welcome national thoughts on that, whether that seems like a sensible aim. subjectively, I feel that if there was one consistent way of reporting an individual's desires around maintaining independence or indeed working towards recovery, that would help multi-agency teams to be consistent about their interventions and would genuinely make things more person-centred. So that's a discussion on outcomes that I'd love to continue to explore. My question is, you talked about the wellness measures, and indeed, I completely understand how difficult it is. Do you have segments of the population that you already have a baseline for in terms of their wellness measures? And are you setting metrics in terms of what percentage you'd like to see that increased by? We'd be grateful for thoughts on any of the scales that you're looking at doing, or how you're going to prioritise particular resident demographics and populations.
Yeah, that's a really good question. Thank you. Data is so patchy. It's really patchy within Birmingham, and we have done a lot within public health to understand different needs of communities. We have our communities team within public health who have created a set of community health profiles, which shine lights on specific communities, acknowledging that we need to dive further into communities, particularly ethnic communities, and thinking around looking at needs at a more granular level. So we have that, and we have some insight, and I kind of emphasize on some, because we don't have those kind of clear metrics on this is this community's level of well-being, or this is this community's prevalence of depression, or this is their ability to access services. It's patchy, and it's just reliant kind of on what we do have. We do have talking therapies data, which gives us a little bit in terms of telling us equity of access compared to population percentages. But acknowledging that talking therapies is one part of accessing mental health support, and we can't rely on just that. We're also starting to look at building a map that kind of builds on the small area mental health index, but also captures some other data that we can get our hands on with NHS colleagues to really shine a map on the areas of Birmingham that have greater need, but lower services matched to deprivation, acknowledging that deprivation and mental illness are heavily associated. So there are certain things that we're doing. It's imperfect. I'll be honest that it's imperfect, but yeah, that's kind of the future direction of us. Sinead, do you want to come in? Because I know that you've done a lot of work with the maps.
Yeah, I'll just add to that. I think you kind of covered the map details, but it's a little bit about measuring. And we know the measuring for wellbeing is not perfect. It's patchy. It's consistent. So the live action plans have KPIs built in place. So we're unpacking each action into delivery and implementation plans. And within unpacking that, we have KPIs, but we're starting from the reach. We're building that baseline within each action plan. What's the reach, the impact of what we're delivering, and how we measure that. Upon doing that, we eventually create our own measure framework, how to measure wellbeing framework for the city. We've got it, but we're starting it from the live action plan, but using the data that already exists within our map. Just trying to figure out where provisions are, where the unmet service areas are, where the individual using granular data. So that's one-on-one calls, that's hospital admissions, that's people prescribed for antidepressants or anxiety. We have those data currently, using that within our map to find out where the need is, but also find out where the provisions are. So we can put opportunities for intervention and support. So we have that gap, or we call missed opportunities. We identify where there is and put the right support in. But in the overall answer to your question, we are building that granular baseline framework, measuring framework for the city from scratch. It will be an uphill process, but we are building that because we know there's a need for it.
Thanks, Sinead. There's a couple of questions in the chat that I just want to address. And then, Charlene, are you okay kind of waiting for 5 minutes, and then we can just push the agenda back a bit slightly? So there was a question when you're talking about kind of winning hearts and minds. I thought it was quite relatable. And how do you buy kind of senior buy-in, especially when mental health is probably not kind of high on their agenda or part of their strategy? Do you have any suggestions on how you would encourage that in terms of senior kind of level? How do you push it to that?
You want me to jump in that, Joe?
I think this is more like a question for everybody, really. Kind of for Lisa, for Joe, for anybody who's actually implementing the framework. Yeah, how do you get senior buy-in?
If I jump in a little bit for mines, yeah, for us, and I think the key thing that what we've done is communication. You know, and I think is once we have the communication right, and we all know we're working with different partners. We are a co-produced strategy for Birmingham, and it has been co-produced from engagement until action plans. But once we get the communication where we want to go, what we want to achieve, and what good looks like for each individual. So how senior, if it's a lived experience individual, what good looks like for you in the space working together. That's the niche bit. And that's a unique bit to get people involved, because they can see themselves in that trajectory, see how it's going to better their objective or remit. That's the buy-in. Once you can clearly communicate that, that's essential stepping stone to a working collaborative together. If I drop one gold nugget on that question.
Brilliant, thank you. We probably only have time for one more very quick question, so I'll take a question from Christine, who's been waiting then, and then Lisa. Perhaps you could just close this part of the session. So Christine.
Thank you and good afternoon. I'm a district councillor and I class myself as a layperson, really. And there's an awful lot of jargon that's just been spoken, and that's very confusing for members of the public. But one of the questions I ask quite frequently is, how do people know? So people who I deal with in the community who may have a sudden crisis that's come about, it could be their partner's really ill or other needs like that, they're in a complete state of confusion and they don't know anything about all these systems. And so it's signposting, really. And who are the professionals? Are you all joined together at that point where the person is in crisis across the NHS and across the community, about how we signpost people through what is an absolute maze of a system? And, you know, even councillors struggle to learn about all the intricacies. So my question is all around signposting, really. Thank you.
Yeah, I'm happy to take this one. And I appreciate that a lot of the language that was in the presentation is quite jargon heavy. I think that's a fair point. We definitely don't do that when we're kind of working at a more grassroots level and out in the community. And in terms of signposting, how do people know? It's us going to places where people are. So we have a number of key spaces within Birmingham, faith settings, libraries. We've started a project at barber shops, which I've seen work in London before as well, and making sure that people in these spaces know how to have these conversations at a lay person term level, but they also are equipped with resources to know how to signpost and what to do within these situations. So yeah, I appreciate what we presented today is probably different to how it works, and we've definitely got further to go. We definitely need to try and make information easier to find, easier to access, more simplified, and using language that's inclusive to all communities. But we've definitely got that in mind through those trusted voices, community leaders and community spaces, going to where people go. It would be kind of my key answer to that question.
Thanks, Joe. Sorry, Lisa, were you can come in?
Yeah, I was just going to come in. I think Christine, I know Christine, and she's an amazing and powerful advocate for health in general, but particularly mental well-being amongst the community. And I think Christine is a good example of how we have an opportunity, and I'm sure you will do this, is to engage elected members in the work, is to, you know, they have influence in their local area. You know, people have a relationship with them, especially when the elected members are like Christine and many others who people do know, who get out and speak to people. So I'd say involve elected members in your work. And there was some great content there on data and how we measure things, and that's important. But let's not forget the power of stories and narratives as data, especially when you are working with communities, community groups, helping them deliver their own ideas for mental health improvement. Sometimes measuring things isn't always the best way to bring the impact to life. Maybe it's about stories, make videos with them, interviews with people. And that also relates to the other question we had about engaging elected members. If you want to get buy-in from the senior elected members in your area and other senior colleagues, stories and narratives can be even more powerful than scores on a questionnaire. But with that, have we got time to take? I've got another hand up, Shazana. I'll leave that up to you.
We've got some really good exchange in the chat as well, which we will share after. Probably don't really have much time, so I want to make sure that we get across to Charlene. And perhaps, I'm sorry, if anybody does have any more questions, you can just drop me an email or include it in the chat, and we'll carry on the discussions on the chat as well whilst we go along. But I'm just conscious of wanting to give Charlene time and Andy as well. So, Lisa, I know you had your hand raised earlier on as well. So, are you okay that we move on? Or did you want to
let's move on to Charlene.
Okay. Lovely. Thank you. Thanks everybody for your contribution here as well. It's a great discussion. I'm sorry to have to cut it short, but I want to give time to our funders who have generously funded the network, and hand over to Charlene as well to give a bit of an update on the Health Foundation. Charlene, over to you.
Thank you, Shazana, and thank you, everyone. Great to be with you today for such a really important and really rich discussion, and hearing about the fantastic approaches across prevention and mental health. I'm Charlene McGee, and my role at the Health Foundation is focused on supporting local and regional government to improve health. And for those who don't know us, the Health Foundation is an independent charity, and we're working to build a healthier UK. And we do this by building understanding and developing solutions around how to keep people healthy in the first place. So that's through things like decent housing, good employment, and high quality skills, and by forging more connected communities. And local government is, of course, at the forefront of shaping these, which we've heard this afternoon, these kind of local assets, really important local assets, and improving the lives of people who are experiencing both health and economic inequalities. And we're so pleased to support the Centre for Mental Health and the network, and really delighted to see the launch of the framework today, supporting mental health through local government. So I'm just going to briefly talk about our work to support councils and flag a few resources that I hope you will find useful. So we commission work from others, and here are some examples from kind of recent partnerships. We've been working with the Growth and Reform Network to build an evidence base of what is effective in improving health and the local economy, what policy change is needed, so kind of focusing on central government, as well as the practical things you can do right now in local and regional government. Our frameworks toolkit is a really effective communication tool. So back to Christine's point around kind of jargon and language barriers. And so the whole point of the kind of frameworks piece is to reframe the conversation around the building blocks of health, and people have found that really useful. We're working with CIPFA to get a better understanding of preventative spend in local government, with a practical focus as well in terms of better understanding how preventative spend is being used locally. So in the slides, which I think will be circulated afterwards, we've linked here to the reports and resources. So do take a look if it's of interest. We also fund local action, so that's directly supporting local teams. And the Economies for Healthier Lives programme ran from 2021 until last year across 5 places. And that was each council with a different focus, from assessing major infrastructure projects according to their health impact, increasing data capacity in employment and skills support, and supporting councils to convene their kind of local anchor networks as influential actors who shape employment and procurement practices locally. We're currently working with the mayoral regions and kind of strategic authorities to explore the role they can play in improving health. And this funding involves dedicated posts in strategic authorities and a central team based in the West Midlands. Their High Up toolkit, so Health in All Policies toolkit, which I've linked to here, is one way that others can learn from what they're doing. So please do take a look. It's aimed at strategic authorities, but can be also used by other parts of the system. And then finally, we also provide tools to support place-based action, and that's really to inform change and to spread really good practice. And I've kind of have a little snapshot from one recent briefing that we have put out, which is putting health at the heart of local growth. And in the briefing, we set out the key ways that we've identified that local and regional government can shape health through economic development. And this is kind of reflecting on existing practice, so through our funded partners, but also looking more widely at existing approaches of kind of high impact, kind of new kind of innovation, I suppose, in employment support and skills development, employers' role in good work and local procurement, and then also through investment and infrastructure. So yeah, there are a whole variety of case studies there. So please do take a look. I'm happy to discuss outside of this webinar if it's of interest, so do get in touch. Also, if you're doing similar work, we're always so pleased to shine a light on really good practice. And ultimately, you know, we want to give local leaders the evidence-based tools to support you to take action and to make visible what has worked, but also sometimes, you know, what hasn't worked, as that's, you know, equally important, I think. So I'll just finish for the moment to say thank you to this Centre for Mental Health and to the other speakers for a really fantastic discussion so far, and really looking forward to the discussion to come and to hear from Andy. So I'll stop there.
Brilliant. Thanks, Charlene. And we'll make sure that we circulate the slides as well afterwards so that you have a copy. I'm going to hand over to Andy.
Thank you. A massive thanks to Charlene and the Health Foundation for supporting the Mentally Healthier Councils Network. We hope we can continue working with you. Can you see my slides okay? Because I don't trust myself. Goodness me. If it's actually
yeah, we can see them. Yeah, absolutely.
That will be the first thing achieved. By the way, this is just one for elected members on the call, okay? Ignore officers just for the moment. Do something else for a second. One of the most amazing things that elected members can do is in debates in council, no matter what policy you're talking about, just ask the person presenting it, have you thought about the mental health implications and what this will do for people's mental health and well-being, or for people living with mental illness? It's really simple, but it's a great way of changing the culture within the council, and it does work. And it doesn't matter whether you're a district, borough, unitary, county, whatever. It really works, and it just helps to shift the culture. So that's one for elected members. Okay, officers, you can come back into the room now. You're all good. So I'm just doing a quick run through of the national picture in terms of policy and where we are in terms of people's mental health right now. I'm going to try and be quick because I want to allow time for a bit more discussion. And it's been wonderful to see the hive mind in action, by the way, on the chat. So let's start with the bad news. Every bit of evidence we've got would suggest that as a country, our mental health is getting worse, and that means more people experiencing mental ill health, but also a deterioration in the well-being of the population as a whole. That's not good news to deliver. It's not great for us to observe, but all the evidence we've got from different sources points to the same thing. We can say pretty confidently that that is worse for younger age groups than older. It's also considerably worse for women than for men, and there is a huge social gradient still. So people who are the least well off, most marginalised, and most disadvantaged have much higher rates of poor mental health, and people with long-term physical conditions as well. There is a huge overlap between mental and physical health, and that's often poorly understood. The reasons, well, Joe talked earlier about risk factors, which are things that in society are more likely to make people's mental health worse, and protective factors, which are things which are more likely to help protect mental health. And what we can see over recent years particularly is that many of those risks are getting worse, not all, but many. And many of the things that protected our mental health have been taken away. And many of those, of course, are related to the work of local councils. So all the austerity cuts that you've been through that have meant you've had to make reductions to things like children's services, youth services, libraries, early help services, all the things that actually are known to be really beneficial to people's mental health and well-being. That's the bad news. In terms of where we are in terms of government policy right now, well, obviously the current government was elected with some specific pledges around mental health and well-being, or certainly around mental health. They have enacted changes to the Mental Health Act. So at the very end of last year, pretty much the last day of Parliament, the King signed into being a new Mental Health Act, which will change the legal framework for mental health treatment. But there were also specific pledges to build the workforce, more about that later, improve mental health support in schools, and put a mental health early support hub in every area of the country. Those are great. We like those. They're not enough, but there's something. It's fair to say government's interests also lie in other areas, and particularly since this government's come to power, they are very concerned about public safety in relation to people with mental illness. They're very concerned about what they describe as economic inactivity, so particularly young people being out of the workforce or struggling in school because of their mental health. They have noticed rising prevalence. They don't always believe it, but they've noticed it. And they see particular concerns around crisis care and pressures on emergency departments. And more latterly, there is a very significant concern in central government about the impacts of social media on young people's mental health. What did the 10-year plan say? Well, the 10-year plan said lots of things. If you've read it like me, you'll know it's a very long document, very long document. And the key features of it really are a move towards a neighbourhood health service. Now, if you work in local government, you understand neighbourhood in a different way to our NHS colleagues, God love them. But by neighbourhood, what that means is a population of around about 50,000 people. So a cluster of GP surgeries effectively. And in the vision of the 10-year plan, most health services that are available locally rather than the very, very specialised ones will be organised around neighbourhoods. And that potentially means integrating mental and physical health support at that level. There's a lot of talk about shifting from treatment to prevention, from hospital to community, from analogue to digital. There are some specific pledges around mental health or mental health services, including investment in NHS talking therapies, in evidence-based employment support, in more alternatives to accident and emergency for people in a mental health crisis, and again, extending mental health support in schools and colleges. That's all good. There is also, as has been noted in the chat, a lot of reviewing going on right now. I won't go through all of these, but here are 8 different pieces of work that are currently happening in or around central government, which are looking at what's going on in terms of mental health and well-being or mental health services. And these aren't the only ones, by the way, but there is frenetic activity right now, which is either about people's mental health or mental health services, or about the relationship with other things. For example, the TIMS review looking at people's entitlements to personal independence payment. That review will have a huge effect on certainly the lives of people with mental illness. It's said quite a lot that mental health is a lower priority these days than it used to be. Now, we can all look back to a golden age that didn't exist, can't we? But there is some evidence, I think it's fair to say, that mental health is being sidelined and it's not as big a priority as it used to be. The mental health investment standard is something which helps to ensure that the NHS gives the same proportion of funding as it did last year to mental health services, and ideally a bit more. That has been watered down slightly over the last year. You will know about the access and waiting time standards for physical health care because the NHS is held to account for it. We do not, in the majority of mental health services, have that same level of protection. You'll remember I said earlier that the government pledged 8,500 extra staff for mental health services over this Parliament, and you'll hear government talking about that endlessly. Over the last 5 years, the workforce increased by 9,000 a year. So that means a slowdown in terms of the speed at which the workforce is going to grow. And then the Patient and Carer Race Equality Framework, a really important programme to bring an anti-racist approach to mental health services. For some reason, that wasn't even mentioned in the 10-year plan, which we think is very disappointing. So what's going to happen next? Well, we don't know, but we do have a new Mental Health Act, so that's got to be implemented, and local government will be at the heart of that. There is huge opportunity to keep moving from hospital to community within mental health services. There is work to develop new outcome measures so that mental health services can be better held to account. Think about the role of scrutiny committees in local government and what scrutiny committees can do to ensure their mental health services are working as well as they should be. We hope that the Patient and Carer Race Equality Framework will be implemented in full, and we'll certainly be supporting you to do that. Local government has sometimes been on the margins of that, but it shouldn't be. It should be right there. And there's a huge opportunity to tackle the life expectancy gap for people with a mental illness. Lisa spoke about local government reorganisation. There is an opportunity there maybe for the new local authorities to start as they mean to go on. We hope the Prevention Concordat will be back in action, and we're certainly doing everything we can to make that happen. We know that there is a lack of central direction on public mental health, and that's a real gap. An interesting development is that integrated care boards, sorry about the acronym on the slide, have been told to stop worrying about the determinants of health and just get on being strategic commissioners of services. That's a shame, but it's also a reminder that that's where local government is actually able to shine through your health and wellbeing boards and your public health teams. If ICBs are moving away from that space again, that's your opportunity to get back in there and make things happen. That's enough from me.
Thanks, Andy. Do you want to open up to questions? We've got a question in the chat. It's just a couple of points, actually. Is there a link to the scope for the Modern Service Framework for Mental Health? And can we just share that in the chat? And do we have any more updates on the Prevention Concordat?
Right, thank you. I haven't seen a scope for the Modern Service Framework, but it will be related to severe mental illness. So that's what was promised in the 10-year plan. It kind of promised that there'd be another plan to come along. There's a bunch of Modern Service Frameworks. This is such jargon. Documents that the government's going to put together that will set out expectations for the treatment of certain conditions. So you'll have seen the cancer plan, which is sort of one. We were devastated by the cancer plan completely lacking any decent information on mental health and any commitments to mental health. What a huge missed opportunity that was. But there'll be a cardiovascular Modern Service Framework. There'll be one for mental illness, and there'll be one for children and young people that will include children's mental health. The exact scope and coverage of those is unclear, and it's not exactly being done in a very open, transparent way yet, I think it's fair to say. The Prevention Concordat's still there, so if you're signed up to it, you're still signed up to it. The government is looking at what it wants to do next with regard to the Prevention Concordat. We've been encouraging them to open it back up again, so watch this space. And we will communicate with members of this network as soon as we get any updates that are useful and shareable on that.
Thanks, Andy. And Joe's put in the chat, it would be great to hear from other teams how they're supporting shifts to locality-based working and ensuring focus on mental wellbeing and prevention. So if anybody has any comments on that or reflections, it'd be great to hear. Lisa?
Yeah, if no one else wants to, I'll come in. And I think shifting to locality and place-based working is absolutely essential in this. And we have plenty of opportunity. Andy mentioned LGR, neighbourhood health, all these big policy drivers are there as opportunities to engage primary care networks, local voluntary sector organisations in more place-based working. And when I say place, as Andy referred to, I'm not talking about 50,000 people. Health outcomes, cultural preferences can shift, needs can shift dramatically within one of those 50,000 people areas. So the more localised the approach, the better. In Worcestershire, we've built our priority neighbourhood development programme based on an LSOA framework, so a lower super output area, which is about 1,500 to 3,000 people. It's what you and I would think of as our neighbourhood, something we can walk around. And that granular level approach has proved really productive. But working with communities, working with people, and remembering that not all the ideas for better mental health have to come from us. Sometimes it's about facilitating and enabling communities to make their own ideas for health improvement a reality through the use of grants, facilitation, community development.
Sorry, I realised I was speaking when my microphone was off. Thank you for that. We have come to 1 o'clock. So if we don't have any more questions, then I'm just going to include my details in the chat. So if you do have any more questions, you can always just email me, and I'll follow up with a digital goodie bag as well, and make sure all the information that we've included in the chat is included in that as well. So just one final thank you from me to everybody today for joining us and using your lunch hour to be with us here today. So to Lisa, to Joe, to Sinead, Charlene and Andy as well for presenting. A massive thank you. Thanks. Thanks, Andy. And we'll hopefully be in touch with our next webinar and next steps and any further updates as well. If you have any items for the newsletter, please do send it through. I'll be sending it out next week. Always good to see everybody, and enjoy the rest of your day. Thank you very much. If anybody wants to stay behind, please feel free to.